We begin the day with those skyrocketing numbers of new coronavirus infections and the recycled recommendations and new mandates being launched to drive those numbers down. Earlier this week in the U.S., the Centers for Disease Control backpedaled on face masks, recommending again that people wear masks indoors with one important difference. This recommendation is for vaccinated people. It comes amid worries that the vaccine may not be able to protect in crowds of unvaccinated people who may be carrying the more transmissible Delta variant. Public health officials here in Europe and in the U.S. are urging people not to wait any longer to get their shots. In the U.S., the number of new people willing to be vaccinated has stagnated. Now, this is important because the unvaccinated comprise almost all hospitalizations and COVID-19 deaths. Public health officials are calling this the pandemic of the unvaccinated. With the vaccine available practically everywhere in the United States, patients with those refusing to get the jab is wearing very thin.
Angelenos have stayed home for over a year to protect themselves and each other. And quite frankly, I think it's safe to say that we're getting tired of protecting people who don't want to protect themselves or get vaccinated. We have 3 vaccines readily available that are effective. We have vaccine events across our city. We have accessible vaccine centers, and even we've gone door to door offering the vaccine shots. Yet we still have people endangering themselves and others. This is truly a pandemic of the unvaccinated.
Well, for more now, we want to bring in Eric Feingolding. He's an epidemiologist and a senior fellow at the Federation of American Scientists. Eric, it's good to see you again. Talk to me, what effect is a face mask mandate for all U.S. federal employees? What impact is that going to have?
Well, a face mask plus a vaccine mandate would be huge because the federal employee and the contractors is the #1 largest employer in the United States. So that would automatically sweep a lot of people under masking and under vaccinations. And, you know, the vaccines, it's actually more of an attestation, not a true hard mandate, because you just need to confirm that you have been vaccinated. And if not, you have to wear a mask and get tested regularly. But this is huge because this is a precedent setting. This sends signals to businesses. Many businesses are now following suit, requiring it. Walt Disney World also just announced people visiting their parks as well. This is a really game changer, and hopefully this will create the tide that will eventually get majority of businesses and states also complying.
Well, Eric, how did the United States get to this point? The U.S. Has been one of the leaders in vaccinations, and now it has been overtaken by the European Union. Why has that lead slipped?
Yeah, it's really been the tale of the tortoise and the hare. And the U.S. has been the hare in terms of coming out very quickly with the vaccinations and rollout. But then we've hit the vaccine hesitancy wall, you could say, in which there's a large fraction, 30% in the U.S., that's just resistant to taking any vaccine shots, and many of them not getting the second vaccine shots as well. So the U.S. is kind of stuck around like, upper 50s, 60% vaccinated. And there's many other European countries in which there is less misinformation. There's still misinformation in Europe too, but the misinformation and the right-wing, anti-vaccine misinfo machine has been really, really much more aggressive in the U.S. And I think right now this is the pandemic of the unvaccinated, but also in which if you're vaccinated and you're not masked, it also allows the virus to keep spreading. So we, even among those who are vaccinated, must take precautions. And the CDC has been, had 2 months of allowing vaccinated people to not wear masks, even despite WHO's urging. And now it's coming home to roost, and the Delta variant is surging.
I'd like for you to listen to what the governor of Alabama, Ivey, what she said this week.
Almost 100% of the new hospitalizations are with unvaccinated folks, and the deaths are certainly occurring with unvaccinated folks. These folks are choosing a horrible lifestyle of self-inflicted pain. We've got to get folks to take the shot. The vaccine is the greatest weapon we have to fight COVID. There's no question about that.
So she's saying there, we've got to get people to get vaccinated. Now, it's just come across that President Biden is asking the states to offer the unvaccinated $100 to get their shots. What do you make of that? $100 to get vaccinated?
Yeah, I think $100 is a great start, and the funding is already there. The issue is we've had lotteries of $1 million. We've had many other bonuses that we've dangled. We've tried almost every single carrot that we had to get people vaccinated, and people are just not budging. The low-hanging fruits of people willing have already taken the shot. So in certain ways, we have to resort to sticks with mandates or these pressure points of potentially vaccine access passes that kind of France has implemented for indoor dining. We have to urge them, and a mandate is really necessary. And by the way, we have mandates for other things: seatbelt mandates, bike helmet mandates. We also have a mandate that you do not drink and drive. It is not about freedom. It is about public safety, all of those laws. And we do them even if the hospital beds are not full as well. So in certain ways, public health really, really is the paramount, that mandates are necessary and they're not infringing freedom, especially if you giving off the virus endangers someone else. Your right to endanger other people ends at my nose, and that's why these measures are necessary.